Signing up for Medicare is easy. The Social Security Administration is responsible for the Medicare enrollment process, and the Centers for Medicare and Medicaid Services, or CMS, is responsible for the administration of Medicare once you're signed up. If you already receive benefits from Social Security or the Railroad Retirement Board, you are automatically entitled to Medicare Part A and Part B starting the first day of the month you turn age 65. You will not need to do anything to enroll. Your Medicare card will be mailed to you about 3 months before your 65th birthday. If you're not yet receiving Social Security benefits, you'll have to sign up for Medicare Parts A and B. Your window of eligibility is 7 months. It begins 3 months before the month you turn 65, includes your birthday month, and ends 3 months after the month you turn 65. If the window closes and you haven't applied, you'll have to wait until the general enrollment period from January 1st to March 31st to sign up. Coverage would then be effective on July 1st, and you may have to pay a penalty. If you decide not to sign up for Medicare Part B when you're first eligible, you may be charged a late enrollment penalty. The penalty is 10% of the premium for the first year you do not enroll and is permanent. For every 12 months you are not enrolled in Part B, the premium penalty increases in 10% increments. There's one big exception to this rule, though. When you turn 65, the late enrollment penalty doesn't apply if you are enrolled as an active employee under FEHB or are covered under your spouse's group health plan and he or she is an active employee. In this case, it doesn't usually make financial sense to enroll in Medicare Part B just yet because your health plan is still considered the primary payer. Once you or your spouse stop working or are no longer covered by the group plan, you'll have an opportunity to enroll without a penalty during a special enrollment period. This 8-month time frame begins the month after you retire. You also have the option to enroll at any time while you are covered by the group health plan. In the Medicare section of all FEHB plan brochures, you'll find the primary payer chart. This detailed chart outlines when Medicare is primary or secondary according to your employment status and other factors determined by Medicare. Even if you don't plan on retiring before you turn 65, you should still apply. Remember, there is no premium for Part A, and you're entitled to it regardless of retirement status. Having Medicare Part A as a secondary payer will reduce your out-of-pocket costs should you be hospitalized, and it will help you keep more of that hard-earned money for retirement. The easiest way to sign up is online. Just go to ssa.gov/Medicare to begin the process. It can take less than 10 minutes to complete depending on your situation. Reviewing the checklist of required information prior to starting will speed things up. You can even save your application as you go and come back at a later time. In most cases, once your application is submitted electronically, you're done. There are no forms to sign, and usually no documentation is required. Social Security will process your application and contact you if they need more information. Otherwise, you'll receive your Medicare card in the mail. Remember, your best and most accurate sources of information on all things Medicare are the Medicare.gov and SSA.gov websites. To learn about the most popular question among federal employees and retirees turning 65, visit geha.com/Medicare. Thank you for watching.